I think we're still learning about what you're asking, that question. I think we're learning that in really young women who get breast cancer, women, let's say in their early 30s, 20s, we don't see a lot of those patients, fortunately, that there may be something different about their biology that we haven't found yet. We know a lot of their biology is somewhat different, but their age seems to be an independent factor in how they do. But if you look at women as they age, let's say from the 40s on, I think it's really more dependent on the type of breast cancer they have, their hormone receptors, what it looks like under the microscope, what their prognosis is. And provided they don't carry one of these hereditary genes, we know overall that if you have any family member with a breast cancer, it confers an increased risk to members in the family. But we haven't pruned that down to know that much about it. And in fact, in the population, most women who get breast cancer don't have risk factors. So most of the patients we see say, I'm shocked that I got breast cancer. No one in my family had it. There's no history, so how did this happen to me? So I think this is your aunt, your maternal great aunt. If that's the only breast cancer in your family, you're probably at reasonably lower risk and similar to other people with families without breast cancer. But we're still learning about this.
Let me ask a question to the panel, because it's a one-word answer. What is the number one risk factor, besides gender, for breast cancer?
I think you're setting me up, but it's age.
Right. So the thing is, if you live long enough, we all acquire these things. And not to talk about prostate cancer, but it makes a point. Essentially, every man who gets to be 100 has prostate cancer. Walter, you want to jump in and say anything here? Because I know you're chomping at the bit. But it makes a point about not getting too bent out of shape about risk at the extremes. We all get something.
Right. Just to move on to other risk factors, I think that it is pretty clear that the risk factors are partly different for premenopausal and postmenopausal breast cancer, but some risk factors are the same. In fact, some of them are even in the opposite direction, like being overweight is related to lower risk of breast cancer before menopause than higher risk after menopause, and we still don't really totally understand that. So, but on the other hand, other risk factors like alcohol drinking are related to both premenopausal and postmenopausal breast cancer. So they're not completely different diseases, but they're not exactly the same either, I think, in terms of risk factors.